Sometimes the messaging gets lost in the noise. When one tries to champion diversity, oftentimes people will say, oh, you're just trying to be selective. It's a net zero game. If we give one group something, we have to take something away from the other group kind of thing, that there's a detriment. And that couldn't be any further from the truth. It's all synergistic. I think it's an important message to put out there is that we all benefit, not just the patients, but each employee, each person that touches that healthcare system benefits as well from a diversity of thoughts and experiences.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. All right, welcome to another episode of You Belong in Here. My name is Dr. Tiffany C. Brown, and I am your host. Friends, I am so excited to introduce my guest for today's episode entitled Empowering Care, the Impact of Black Doctors in Your Healthcare Institution. I am chatting with Dr. Leah Backhus, who is a thoracic surgeon and practices at Stanford Hospital and is Chief of Thoracic Surgery at the VA in Palo Alto. She is also co-director of the Thoracic Surgery Clinical Research Program and has grant funding through the Veterans Affairs Administration and NIH. Her current research interests are in imaging surveillance following treatment for lung cancer and cancer survivorship. She is a member of the National Lung Cancer Roundtable of the American Cancer Society and the Task Group on Health Equity. She also serves on the board of directors of the Society of Thoracic Surgeons. As an educator, Dr. Backhus is the Associate Program Director for the Thoracic Track Residency and is former chair of the ACME Residency Review Committee for Thoracic Surgery. She also, amongst all that, takes pride in her family and is a wife and mother of 2 children. Also, I will add this, an amazing friend. She has been quoted saying, as an African American female thoracic surgeon, one can feel a bit like a pink unicorn. But my hope is that over time, this forest of surgery will have a huge population of unicorns who are all thriving. So let's give it up for the thriving unicorn, Dr. Leah Backhus, everyone. Thanks for joining me today, Dr. Backhus. How are you?
I'm well. Thank you very much, Dr. Brown. This is a lovely invitation and opportunity. Any opportunity I get to hang out and chat with you is great. So
I agree. Hey, you know what? That's what we're here for. We have to support each other in the healthcare field. So that kind of leads me into some statistics amongst Black physicians that I want to start with the United States. So according to the latest data from the Association of American Medical Colleges, only about 5.7% of physicians in the United States are Black or African American. Also, I recently read a research article that you co-authored featured in the Annuals of Surgery entitled A Call to Action, Black African American Women Surgeon Scientists, Where Are They? In this article, you all highlighted a study of 15,671 U.S. medical school surgical faculty, and only 0.79% were Black African American women. Man, given this surprising statistics, I think this is a great way to kind of segue into you sharing your journey into healthcare. So can you share your journey into the healthcare field and what motivated you to pursue this career path?
I wish I could say that it was really deliberate and strategic and well laid out. It was not. I always wanted to be a doctor as far as I could remember. And in the 6th grade, I feel like a broken record, like I've told this story before, but in the 6th grade, I decided I wanted to go to Stanford and I wanted to be a neurosurgeon. So for the longest, I held on to to both of those. I did go to Stanford for college. That was one. I give myself about 75%, because I did that one, and then I became a surgeon, but not a neurosurgeon. I held on to the neurosurgery thing all the way up until second year med school, actually. So it just made sense. Surgery is a very definitive field as a problem, and you just get in there and you manually fix it for the most part. So it's very gratifying in terms of the immediate gratification of an intervention that you're doing to help somebody.
Absolutely. I think that's awesome. So how would you say your identity as a Black provider influenced your experience in the healthcare profession?
I think that's a really tough one, because, your sense of self is multifaceted, and it's very difficult to tease apart any particular facet of yourself and view it in isolation. I think the further I've gone in my career, the more appreciative I have been of the people that have helped me along the way. And the more I look around and recognize the rarity of my presence. So I feel a tremendous obligation to look around, look for people who may be less comfortable in that rare air, and try to reach out to them and help them benefit, if any, from the journey that I've taken. I don't think my journey has been particularly difficult necessarily. I'm not going to, sing a terrible, downtrodden, sad story, because it's been, for the most part, fantastic, which is why I'm still here. So I feel like my job is to continue that same pay it forward, basically, right? To make sure that I'm part of the change and part of the things that help motivate the next person behind me.
That's good. That's good. I like how you say pay it forward. That kind of like lends to mentorship. So in your experience, how do Black healthcare providers foster trust and rapport with patients with similar backgrounds?
That one's easy. I mean, honestly, most of the time I don't really have to do anything. Your sheer presence can be incredibly reassuring for somebody, particularly depending on your field, right? I mean, no one usually goes to the doctor because they feel great, right? Like they're there for some reason, something is wrong. And especially in surgery and in cardiothoracic surgery, often something is very wrong. So, the patients are in a very vulnerable state, and they're kind of looking for buoys. They're just looking for things to grasp onto in this sea of uncertainty. So, if they view my mere presence as being somewhat kinfolk to them, then I think that can be very assuring, as it has been expressed to me. It's not necessarily an assumption. These are just some of the things that people have otherwise expressed. So I think it can be very reassuring. And it's not just the patients. I can recall being on many an elevator and having people of the staff, hospital staff, the custodial crew, the cafeteria workers, etc., throughout the whole healthcare enterprise, looking at you with your scrubs on or your white coat or what have you, and really being giving great deference. I'd say I've never had someone of a different race or ethnicity unsolicited come up to me and say, "Oh, wow, I'm so proud of you, doctor." And yet I've had that happen a number of times from other African Americans from various walks within the hospital.
That kind of goes obviously into what this podcast is about. Like your presence is necessary, even if, when you're going into it, when you decide on the field, it may not be what you intended to be, but you're supposed to be where you are, and we're supposed to see it as well. So that kind of leads into my next question for you. How do you, as this unicorn, Black thoracic surgeon, believe that Black providers contribute to a culturally competent care within the healthcare institutions?
There was an interesting article that I love to quote, different invited lectures that I give, where I was looking at treatment of myocardial infarction and looking at concordance between gender and race. And, of course, they found that when things are concordant between patient and provider, that outcomes are better. That really wasn't very shocking information. But the thing that I thought was most striking about that was that providers who worked in more diverse environments, such that they had colleagues who represented the minorities within the population that they treat, they actually did better in treating these minorities,
Yeah.
right? And so that speaks volumes to me, because I feel like sometimes the messaging gets lost in the noise. When one tries to champion diversity, oftentimes people will say, "Oh, you're just trying to be selective, and you're trying like it's a net zero game." Where if we give
Yeah.
one group something, we have to take something away from the other group, kind of thing. That there's a detriment, and that couldn't be any further from the truth. It's all additive, it's all synergistic, it's all good, basically. So I think it's an important message to put out there, is that we all benefit, not just the patients, but each employee, each person that touches that healthcare system benefits as well from a diversity of thoughts and experiences.
I couldn't agree more. That was beautifully said regarding the cultural competency piece specifically. What challenges or barriers would you have, say, you've encountered as a Black provider in healthcare institutions? And how have you navigated those challenges?
I mean, I have to say, you and I are both, sort of double minorities, right? So both being female and African American. I think because of the world that I live in of cardiothoracic surgery, I feel more of a gender bias than that of race and ethnicity. I mean, they're
Okay.
intricately combined, but I do think that there's perhaps more of a gender issue than anything. And some of that may be to being here on the West Coast and kind of living in this little very liberal bubble in the Bay Area, recognizing that we don't represent the entirety of the country, that let alone the world, right? But just looking at the country,
Right.
we're a bit of outliers in lots of ways. So I think that I've probably experienced it more from a female perspective than anything.
Okay.
And not in an everyday way, not in something that's, completely weighing on you all the time, but just enough to make it a thing. And that can be from colleagues, that can be from folks not in your institution, but like in your various organizations that you serve. And it can also be from patients. And I think the latter is actually the most painful. That's the one that really kind of gets you, because you have nothing but altruism in your thoughts and intentions and your interactions with a given patient. And yet sometimes that can be overlooked when patients may ask for, self-refer to one of your white male colleagues. That's not disparaging my colleagues. It would be great if and when the colleague says, really, you should stay with Dr. Bacchus. There's no issue there. Like, she's great. I mean, that's called being an upstander, right? Like, so when your colleague decides to do that, that feels fantastic. At the same time, how do you pull yourself back up together again, knowing that this exchange happened, and still provide appropriate care, et cetera, for your patient?
Yeah.
So, I mean, when that happens, it definitely causes you to pause for a moment. You kind of lick your wounds a little bit, get yourself back together. But I would say one of the hallmarks of medicine, and particularly of surgery, is our ability to compartmentalize things. And so, you just pull out your compartmentalization toolkit and you park that very firmly in the category of, I got to do the right thing for the patient, regardless of anything I might be seeing, thinking, feeling, or they may be seeing, thinking, feeling, kind of thing, right? Like we do that a lot. I mean, in surgery, you can't be walking around trying to operate on somebody, feeling a certain way emotionally. Like, you've got to set all that aside and do your job. So we do it, but it does take a little moment to regroup.
Thank you for saying that. Like, something that I don't think people realize, in different gender groups, racial groups, right, is some of the compartmentalization that we have to do in order to continue and push through the day and push down your feelings. And something that I've said, like going to work with my armor on, you know what I mean? So you kind of have to put up a shield, You know what I mean? In order so that you can give the best care that you're not obligated to give necessarily, but that you want to give. You know what I mean? So it's sometimes being your best self in that moment and being your most professional self, your most unicorn self, your skills as a thoracic surgeon is compartmentalization. And it's kind of not fair, but, and it's not fun. But, I thank you for mentioning that. I did want to ask you, like, what strategies do you use for like self-care, and how you've built this level of even resiliency that's necessary to do your job when those moments happen?
Yeah, well, to continue, I love analogies. So continuing with your analogy of armor,
Yeah.
armor sounds a little bit hostile, but whatever protective mechanisms you have, etc. But it's sort of like your resiliency armor. I do think that you got to polish it, like if you don't take care of it, it's going to get rusted. It's going to get holes in it. So I think that the self-care is the polishing that goes on. And in the same way that you'll have lots of thoughts and feelings throughout the day that you wind up suppressing or compartmentalizing, and you have to acknowledge them and do something with them, do something about them. You can't just kind of let it fester. It's like an abscess that you lint it, you got to get the pus out. If you don't, you just try to suture the top of it, it's just going to fester and grow and get worse, right? So you got to get it all out there like a good IND. Anyway, enough with the analogy.
I know, we talking, you got to get the pus out. Surgical talk. I love it though.
You gotta let it out. You've got to create your little village.
Yeah.
You've got to create your safe spaces that you can say the things in those safe places and get reinforcement to fill your cup back up, your resiliency cup, to polish your armor so that you're then ready to go back out and do battle. Do all the things that you need to do on a day-to-day basis. Not everything we do is battling, you know what I mean? But you've got to take care of it.
Absolutely. 100% on all of that. So everyone who's listening, you got to remember, get your lance. You got to get the pus out. And then you got to let it heal internally and come, in order to shine your armor, just, remember what's inside of you, absolutely. So I want to ask you another question, kind of like leading into another angle. Like, why do you think that representation of Black providers, you mentioned it a little bit, but why do you think it's crucial in healthcare settings, both for patients and for a healthcare force?
I mean, it's a no-brainer, honestly. For patients, all the data are there demonstrating that, having a diverse workforce is more beneficial, associated with better outcomes for patients or pretty much every disease state condition that you can think of, right? And that's not just in highly technical things like surgery, that's for pain management, that's for obstetrics, that's for nursing, that's for everything. You pick and it's there and it's been demonstrated. So I think that that's kind of a no-brainer, and that folks that would otherwise not want to support those efforts are really sort of hiding behind archaic thought processes. They've got to sort of just I don't assume that people are malicious. I assume people are uninformed. And so I feel like it's our job to get the data, the information out there so that people can be better informed, make better decisions. I mean, for the most part, people that go into healthcare are helpers. We want to fix, we want to help, we want to, provide support, etc. So we're already coming from a helping mindset, from an altruistic mindset. And I think we need to leverage that. We need to exploit that and say, listen, if you're all about the very best for your patient, this is part of it.
Yeah.
This is part of it. So whenever I go out and give talks and things like that, that's my shtick, is that you can't have excellence unless you've got diversity in whatever you're trying to do. But particularly for healthcare, we're like, it's all about the patients. Like, you can feel any which way you want to, but if this is what you really say is at your core, then you've got to embrace this concept. And I do think it's important, just, like I mentioned, for the cross-fertilization, the cross-cultural trainings informally that happen within any given unit or whatever, that it's critical and it's all additive. We've got to get away from and sort of expunge from people's thinking that somehow it's taking away from something else. It's just
Yes.
gravy. It's cherries on top of sundaes. It's a little sprinkle of garnish. It's it's added. It's something that's beneficial to everyone, to the whole dish.
Yeah, absolutely. Beneficial, additive. You can't have excellence without diversity. I'm going to quote that.
Yeah.
You cannot have excellence without diversity. So, what is your vision for the future of Black providers in healthcare institutions and particularly surgeons? And what changes are necessary that you think are to get there?
Well, I would love to share the burden because it is a burden. I mean, it's a privilege. I recognize the fact that I'm in a position of great privilege for so many reasons. And I try to be a good steward of that privilege.
Yeah.
To respect it, to care for it, to do my due diligence, to recognize that anytime I go somewhere professionally, that is, that there's lots of eyes on me that I don't even necessarily want or command or know about, right? But they are. And so you've got to remember that. You don't get the luxury of anonymity, because you're that pink or purple unicorn. So you don't get to blend in the forest, right? And that's okay. Like, I'm not trying to blend in the forest necessarily. But it does get exhausting. And so to your question, what would I love? I would love for other people to help pick up the flag and be champions that don't necessarily look like you or I.
Yeah.
Because the minority tax is real, and it's a tax I pay. I'm a diligent taxpayer, but sure would be great if I could get a tax break.
Wouldn't it though? Trust me, it is a weight, and but I believe that we're strong enough to carry it. Like that old saying that God wouldn't give you more than you can bear. And I think that we're called to this. So we're called to be armor bearers of that too.
That's one of the reasons why you wear so many hats, though.
Yeah, I know.
You're not out there trying to grab all the hats necessarily, but people tap you for all sorts of things, and they're not necessarily career enhancing.
Correct.
You do them out of obligation. And so my job now, more contemporarily, is to say no and to offer up additional names and then make people do the work.
Yes.
They see you because you're a prominent person and they gravitate towards you. But you're like, look around.
Yes.
Look around. What do you see? There's lots of people that could do this,
Absolutely.
But you're just not really thinking like that. It's almost like lazy thinking, though. So I'm like, you got to do the work. You got to do the homework. You can't just pick the first Black person that you know in your little circle, right? Like there's so many more people out here. And if you need help, I can be a helper. I can be a facilitator to help you to see what you don't see intuitively.
Yeah, I love that answer. Enlisting others, not just me, and the ability to say no. You have to know your boundaries. It's important. And you can't save the world, right? You can't be the one to do everything. So how can existing Black providers mentor and support the next generation of healthcare professionals that are entering the field? What would you say to that?
I mean, I would say there are innumerable ways, recognizing that this is an extra task, right? It's a little bit of that minority tax. You got to figure out how to do that work in a way that's meaningful and that's not overly burdensome for you. It's different, right?
Yeah.
There's some people that are going to be out there that are going to be chairs of DI committees doing this, that, and the other.
Yeah.
And there are other people that are like, no, that's not really my thing. Like, I don't do that, But you can help and contribute in so many other different ways. I feel like I do all the ways, but I think recognizing that everyone has a different amount of personal real estate that they're willing to, put out there. And we have to be receptive and take it in whatever form. We have an organization, an Association of Black Cardiovascular and Thoracic Surgeons, which actually is quite old, maybe 30 years old, something like that. I mean, it's not that old in terms of surgical societies, but it's about 30 years old. But it was like defunct. And about 5 years ago, we resurrected it. We, as in a core group of CT surgeons, resurrected it. And it's thriving. It's flourishing. We have like 250 people largely that are trainees. So medical students and residents who really flock to anything we do. All we've got to do is put up a shingle and say, or, we're having a Zoom on this topic, or we're getting together at this meeting, what have you. The turnout has been phenomenal. The appetite for progress has been tremendous, and it really does fill your cup. It's one thing to stand up and give lectures. It's another thing to just sit and talk with individuals. So anyway, that was a long-winded answer. I would say there are innumerable ways to help move the needle, but one has to do their own personal check to see what they're comfortable with expending from their bank account, right? Because this is not free.
No, it's not. And that's a good reminder, like you're extending from your own bank account, even when you're mentoring other people. You know what I mean? Like when that's from your own deep desire, and, that's important to have in your consideration of mentoring. So given time, I know we're going to kind of segue into the Pearls of Wisdom segment. As we know, pearls symbolize inner wisdom. So Dr. Bacchus, what is one piece of advice you would give to other African American physicians or other healthcare providers or students, who may be experiencing some challenges that maybe you've experienced in your career, or to those that are entering the career in the medical field?
This is such a hard one to distill things down to one little pearl or nugget. I think that my biggest recommendation for folks is that there's a podcast by Michael Mattis. He's a thoracic surgeon who's like a phoenix. He gone through all this stuff, and then he's risen, and now he's like this huge wellness guru. But his big article that he wrote was called the Resiliency Bank Account.
Ooh.
And it's really real. I would encourage people to give it a read. It's a relatively quick read. I'm sure it will really resonate with many folks. But I would say do that. Make your resiliency bank account. And I think the way that physically manifests is that you cultivate what I call your brain trust, that the group of safe people amongst which you can bounce ideas off of, seek solace, say crazy things to, get very good feedback from, and all the things that are going to be critical to make good strategic decisions for yourself. I mean, any given random situation that I could be in, I have more than one person that I can call and talk to about it,
Yes.
And not just talk to, but talk to and get some really good, poignant, candid advice. So anyway, work on your resiliency bank account and build your brain trust, which when you're very junior will have a lot of peers, but those peers are going to go with you, and they're going to become really powerful people too. So.
Well, that's awesome. Well, folks, this concludes this episode of You Belong in Here. Thank you so much, Dr. Bacchus, for being such an amazing guest, sharing your journey and pearls of wisdom with our listeners. And thank you all listeners for tuning in. We hope that this episode reminds you that your presence is necessary and you truly belong in your workplace or a place of school. If you're a student, you belong in there. And if you found this episode encouraging, motivating, inspiring, and or empowering, which I hope you did, please share it with others. You can find this podcast on YouTube, Spotify, Apple Music. You can even go to my website, belonginherepod.com, to find guest information and podcast episodes. And please tune in to our next episode in 2 weeks, where we will continue to explore topics in equity and healthcare and all that good stuff. We're going to get into it. And thank you all again for being such great listeners. Have a good day.